therapist, physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heine, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today our video is called What is Sciatica? Again, this video is a part of a series of videos on sciatica. And if you want to see the entire series, go to bobandbrad.com and look for the video series or the video programs.
Sure.
So,
it's all there.
okay, what is sciatica? Sciatica is a term for symptoms that arise from the sciatic nerve.
Right.
So that's, if you want to show Brad on, so we got these little nerve roots coming out.
Oh, sure. Should we get right into that?
Yeah, why don't we get it right in there right away?
I've always thought sciatica was a little bit of a misnomer, but everyone calls it that, and that's fine. Because it is the sciatic nerve. These nerves here on the lumbar spine, they're not chopped off like this. This is just a model, but they continue and they bundle into a bunch of nerves right where this pen goes through and then down the leg. And they have a specific map. This nerve goes to a part of your leg. This nerve goes to a different part of your leg. So when you have sciatica, it's typical that only a certain part of your leg, like I ask questions, is it in the front of your leg or in the back of your leg? Because that gives me information
as to which level it's at.
Which level it's at. And you don't really need to know that. As a therapist or a physician, that can be important, but don't worry about that now. But just so you understand, and the bulging disc right here is a good model of how disc can bulge out, and you can see where it puts pressure on that spinal nerve, and that nerve is going to be the one responsible for that pain, numbness, tingling, those typical symptoms that you have in the leg. Also, you could have a healthy disc where this, let's say we're looking at this one, but let's say the hole or the foramen where the nerve exits has become smaller, and it can be from bone spurs, it can be from scar tissue from an injury.
Degenerative changes with arthritis.
There you go, yep. As you age, and that nerve can get pinched because that hole is becoming smaller. Are you zoomed in, Mike? And sometimes that happens when you bend backwards. You can see that hole get smaller. And if typically people with stenosis, when they go forward, you can see it opens up. Now that's exaggerated there. That doesn't happen, but it gives you the idea. So we're going to focus a lot on what happens when a disc, because this is probably the most common cause of sciatica.
So the nerve can be compressed with the two methods that you mentioned, through the disc and also through the hole.
Right.
There's a third one. There's a piriformis muscle. It's a small little muscle on the back of your pelvis that goes to your hip. And that the nerve sometimes penetrates through it or goes underneath it.
Right.
And if that muscle gets irritated or tightens down over the nerve, it can send pain also down the leg.
Right.
But we're not going to talk about that on how to treat that in this series of videos. In the future, we'll do that. Ours is really mainly focused on the disc. We'll talk a little bit about stenosis because some of the flossing might help with that.
Sure.
But so one thing you want to understand is that with sciatic pain, the more that it travels down the leg, the further it goes, the worse it's getting.
Right.
Without a doubt. If it's going all the way down to your foot, that's about as bad as it's going to get. If it starts coming up to the point where it's no longer in the foot and maybe no longer in the calf, it's just in the back of the thigh, that's better. So we're looking for that in the treatment. We're trying to get that pain to retreat, basically.
It goes down the leg and down into the foot. And then actually we could mention that if it gets worse than that, that's when your muscles turn off.
Right.
So if you can no longer lift up your toes like this, the nerve is that pinch. You really need to get to the doctor for sure and have him have it addressed professionally.
Yeah, we're going to say this throughout the video series, but we recommend that you definitely see a doctor at some point with sciatica, because it's just not something you want to mess around with.
Right.
You want to make sure you're properly diagnosed.
And actually, some of these series are really helpful. We've had patients comment where they understand what's going on.
Right. They're a bit more of a participant in the process instead of just standing idly by.
And oftentimes, almost always, when you understand what's going on, things get better. You're more relaxed. You can comply to the exercises and what you should and shouldn't do.
Exactly. Thanks for watching.